What is this device that's behind me? This is called transcranial magnetic stimulation therapy. Okay, so TMS therapy. Now I'll say that again because most people, when I say it, they're like, huh? Transcranial magnetic stimulation therapy. We typically call it TMS. So what is this and who does it help? Well, transcranial, okay, so it's going to be applied to the cranium. Really, it can go anywhere in the cranium. Magnetic, so it's got magnets and it delivers magnetic stimulation to help with a wide range of things. Now, it's been researched all over the place, right? So if you were to go to PubMed or Google this, you could put almost anything with it. Depression, anxiety, insomnia, PTSD, autism, stroke, dementia, migraines, and much more. And you would see that it's been researched. Some of the research is better than others. It looks more promising. And you've got some that's like, oh, you know what? It doesn't do as much as we would like. That's okay. This is one of many tools that can help people with their neurological health. Now, who am I? I'm Dr. Spencer Zimmerman. I'm licensed as both a doctor of chiropractic, a diplomate in chiropractic neurology, as well as a nurse practitioner. And I've been using this therapy for the past few years. Now, most people use it for depression, anxiety, insomnia, but also use it a lot on the concussion and brain injury side. And one of the most common questions I get is, well, how does this thing even work, right? So it's gonna sit there and do what? Well, it's gonna deliver impulses to your brain to change how it connects. So I want you to think about this like a band, right? Is you've got the drummer, you've got a bass guitar, you've got the regular guitar, and you want them to play music at a certain loudness. You don't want them to be too quiet, but you also don't want them to be too loud. So depending on how the machine is programmed, it can get it back into sync of where it needs to be. And this is done through what's called neuroplasticity. Neuroplasticity is a term many people are using, but a lot of people still don't quite yet understand. Neuroplasticity ultimately is the ability of the brain to change how it's connecting based upon input. There's a lot of different inputs that can come into the brain to change how it connects. TMS therapy is one of them. So if we use depression, which is one of the most widely researched things for TMS, it gets applied to the left dorsolateral prefrontal cortex, and it gets applied in a way to promote stronger connections. Okay, so in the world of neurology, we call that long-term potentiation. Hey, we want this potential, right? We want it to strengthen. Whereas if we were looking at anxiety, we would do the opposite, right? So we'd stimulate the right dorsolateral prefrontal cortex in a way to say, hey, you know what? You're overconnected, man. Like, let's kind of chill out a little bit. Let's calm down. And that's called long-term depression. So TMS therapy is widely used for a lot of different things. We use it based upon what the research is showing. Many people do not use it quite to the research ability. They really keep it low key, depression, anxiety, but it does offer a lot of potential when you've done a lot of things. Then we have to look and say, look, what's missing in your story and what piece of the puzzle could be added? Because the other thing is, right, this is a tool to help with neuroplasticity, but there are many things that can impact neuroplasticity. So that's another word of caution. As cool as it is, and there are people who will do it for depression, anxiety, and they will tell you it was life-changing, and that's all they did. But for other people, this is one of a set of tools that they need. And so if they do it in isolation, they often will leave frustrated because they didn't get the results they wanted, because it can act synergistically with other things. So here at Peak Brain and Body in Tampa, TMS is one of the many tools that we have to offer. We also do a lot of neurological based therapies, vestibular rehab, vision therapy, hand-eye coordination, cognitive-based therapies, nutritional supplements, and much more. We're revolutionizing the way brain health and body health is done in Tampa, Florida, and beyond. Till next time, this is Dr. Z.